Hello and welcome to Just the Facts Podcast. This is your April 13th, 2020 update. I'm your host, Dr. Michael Bechill, and here you're listening to the Coronavirus Podcast that focuses on what's going on around the world, what's happening in your neighborhood, but most of all, just the facts. Today's episode is going to be very exciting because I get to offer you a welcome to Peak Day. So if our models are correct, today is supposed to be the peak day for Indiana. So what does that mean? Well, if you look on this slide, you can see that we're up to 8,236 cases. You can see the distribution around the state of Indiana above that data. 350 total deaths. Again, you can see the county by county distribution above. And then on the right-hand side, you can see the modeling. And so today, if our modeling holds true, we are expecting somewhere in the ballpark of around 40 deaths, and then the total deaths should flatten out and then start to downturn shortly thereafter. So today is peak day. Very exciting. We'll see if this data holds true, but I'm interested to see where we go from here. Now, as we move forward, today's podcast was actually originally supposed to be part of the released podcast that was done over the weekend. However, it was so large that I split it up into several podcasts. So today you're going to see some updated numbers. These numbers might be a little less than what I just showed you because, again, this was projected to be released last Friday. But then we have some outstanding local information to talk about what we're experiencing here in Indiana, more specifically what's happening in Allen County, and even more specific than that, a little bit of information from Fort Wayne. Then we're going to go into a little bit of kind of cutting-edge research on SARS-CoV-2, especially when it comes to the idea of reusing your masks. Then after that, we're going to talk about some updates on local and regional policies, answer a few of your questions, and then talk about some future episodes. So thank you so much for tuning in today, and we'll jump right in to looking at some updated numbers. So first, an update on the numbers. So when we look at the United States as a whole, we're seeing 395,784 positive cases in the United States. This is out of just a little bit over 2 million tests done. And we're sitting somewhere in the ballpark of around 12,770 deaths. Again, these numbers are changing every day, so you can watch the news or other local sources to get those cutting-edge numbers. But this gives you some ballparks of where we're sitting right now. In the news, you see New York being featured a lot. You could see that they are now leading the country in COVID-19 cases. And as a matter of fact, if they were their own country, they would have more cases than anyone else in the world. And so we're at 138,863 positive tests in New York. And that's the current updated numbers. And so if you see a little bit of discrepancies, these are as up-to-date numbers as we can possibly get. I believe they were last updated this afternoon after 5 o'clock. New York's also sitting somewhere around 5,489 deaths. They may be starting to plateau a little bit. The last several days, their deaths have been in the 700s. And so it seems like they're plateauing a little bit. We compare that to Indiana. Indiana is the 14th highest state in the United States for confirmed or reported cases. We're currently at 5,507 total positive tests from a total of 28,764 tests given. And so you can see that our number of tests that were given, shown here on this gray line, have really started to take off. So even though our testing was very, very sluggish to start off with, you can see here towards the end of March and the beginning of April, our total number of tests are really starting to take off. So that's a good thing to see. And you can see our number of positive tests are increasing as well. Kind of gives you an idea of where we're sitting. The comparison that people always want to make, especially in Indiana, is how is Indiana comparing to New York? And luckily, because of the significantly lower population density in Indiana compared to New York, we seem to be doing pretty well. If you look at it from the percents game, so far in Indiana, 17.58% of people tested are positive in Indiana. So that's of the total population. And you compare that to Indiana, where they're at a 40% positive test ratio, you can see that we seem to be doing a better job at flattening the curve. Again, most of that can be attributed to the lower density that we see here in Indiana of just people. Now, an interesting number to watch down here is this death rate. So of people that are infected, we're at 3.14%. Now, this number is up dramatically over the last 2 weeks. 2 weeks ago and several weeks before that, the death toll percentage was sitting at about 1.3%. So of 1.3% of positive cases, 3.14% are now fatal. 3 weeks ago, it was about 1.3%, about 3 weeks ago. Last week, that percentage had jumped up to around the ballpark of 2.4%, and now we're all the way up to 3.14%. And so it is important to watch this number. It really is an indication usually of how stressed the hospital systems are. So, for example, Italy's death rate was very low until their hospital systems became overrun. Luckily, in Indiana, at least, the numbers, as we model this out, it's looking like that we are not going to get overran. The hospitals will not be overfilled in Indiana in the coming weeks. Indiana is projected to peak in the next 6 days. And so we really will have a better idea by next week's broadcast where we're sitting in terms of the hospitals, the bed situation, and we're going to continue to watch this percentage here. So does 3.14 hold steady, or does that continue to go up? Unfortunately, in New York, they're a little bit higher, so their death rate is at 3.95%. When we compare Indiana to the United States as a whole, again, that Indiana number is holding as it did in the previous slide, that 17.58% in Indiana. You compare that to nationally. Of those tested, 23% are testing positive countrywide. And then you can see that our Indiana death rate in Indiana is actually a little bit lower than the national average. So we seem to be matching up well with the national averages at this point. If we get a little bit more granular, this broadcast is being made in Fort Wayne, Indiana, which is in Allen County. So if we look at Allen County specifically, we have in Allen County we have 95 positive cases and 7 deaths. And this is out of a total of 637 total tested individuals. So a lot of people are asking us what does Allen County or what does Fort Wayne look like, and that's as granular as we're able to get for you. And then when you compare Allen County to the rest of the country, you can see that Allen County's testing positive at 14.91%. So we're a little bit lower of those testing positive than compared to even Indiana. But the death rate in Allen County specifically is 7.37%. A lot of that is attributed to just the fact that we have a very limited number of tests that we've been able to perform in Allen County, so the data here is small. As we continue to test more individuals in Allen County, we will watch this number drop. So typically, as long as the hospitals are not completely overrun, which they're not, especially here in Allen County, that 7.37% will start to drop down. One of the counties that we also wanted to kind of put under the microscope today was Marion County. Marion County has the highest COVID-19 cases and deaths in Indiana. So this county alone is counting for 22,290 confirmed cases and 58 deaths. And so, you know, they are really the hotbed for cases here in Indiana. And so if you were to compare that Marion County to Allen County numbers, here's just a visual representation of that on the right. and some facts and figures here on the left. So one of the things that is important when you look at this outbreak is the outbreak is going to be substantially different in various counties and in various parts of the state, especially when you look at the state of Indiana, right? You have Indianapolis, and then you have Fort Wayne, the two largest cities in the entire state. But once you get out of those two large cities, the population really does become quite dispersed. And so with that, you're going to see a decrease in the amount of testing that's happening in these rural counties. And so, the numbers will become quite dispersed. But when you compare Allen County to Marion County, these are kind of the differences that we're seeing with the percentages on the left and the graphs on the right. So here in Allen County, we seem to be doing pretty well. Here's some demographic information. Now, we want to realize that only 10% of the demographic data is reported. So we only have 10% of demographic reported, so that means 90% we don't know. And so these numbers that we're giving you right now, there is like significant room for change, significant room for variation. But if we look at the data that we do have, this is the breakdown in both gender and in age. And so interestingly, statewide demographics for Indiana are showing a higher percentage of infections in women. That is pretty much against the grain when you compare cases from around the globe. So when you look at cases of COVID around the world, you're going to see that men are much more are becoming infected much more at a higher frequency than females. So knowing that women do outnumber men in Indiana is an important fact to know. And then here's the age breakdown. So 17.1% of the state is between the ages of 40 and 49, 20% roughly between 50 and 59, and then only 17% between 60 and 69. And so the purpose of this graph is to just give you an idea a little bit of the general statewide demographics for Indiana. Also here on the right, you can see kind of a heat map of where we're seeing the majority of the cases. So as you might suspect, we see the most number of cases in Indianapolis and the surrounding counties, which is, again, this is the largest city in the state, so that makes sense. And then up here in Allen County, we're seeing a high degree of cases because that is where Fort Wayne's at. Now, there is one other hot spot or hot region that you should be familiar with, and that's just up here in the region, and that's because of Chicago. And so these numbers really aren't too surprising. But when you start looking at not just the number of cases, but you apply these numbers of cases that you're seeing in the states, and you compare that to the demographics, you can get some interesting data. And so when we look at the statewide demographics for positive cases in Indiana, so here we're looking at COVID cases, now we know the percentages of males and females in Indiana, and we now know the age distribution that we covered on the previous slide. How is this virus, how is this infection impacting those populations? Interestingly enough, even though women outnumber men, they only account for 37.4% of these cases, men 62.6% of the cases. And this is a trend that we see globally, that men seem to have higher infection rates with COVID-19 disease, or that's caused by SARS-CoV-2, than women. When we look at deaths per age group, again, this is only looking at Indiana. From the ages of 0 to 29, we currently have no deaths. 30 to 39 account for 2% of the case fatalities. 40 to 49%, 2.5%. 50 to 59, 6.9%. 60 to 69 is 18% of the cases. 70 to 79 is 32% of the cases, and 80 plus is 37% of the cases. So, as has been reported globally and across the world, It does seem that age is playing a significant role in people that are coming back positive for this infection. These numbers also are probably a little bit skewed because most of these tests are being performed in hospitals with hospitalized patients. And if the elderly population is being impacted more, you're going to see more of the percentages lean that way. And that's exactly what we're seeing. So the distributions of who is getting infected, both by gender and by age, are matching up fairly well with the world trends. When you look at the infections globally, we're up to 184 countries globally. We're over 1.5 million total cases, and the U.S. is leading that at over 430,000 at this point. And so these numbers, again, are updating constantly, but what do the trend lines actually look like? Are we flattening the curve? And the answer is, in some areas, yes, we are flattening the curve. It looks like New York is starting to flatten out. Ohio and Michigan look like they may be starting to flatten out, but there are other parts of the country that are still in that full exponential curve. So as we work our way to the south, we work our way to the west, they still have a long way to go. Again, Indiana is projected to see their highest cases of fatalities in about 6 days if the models hold true. And so, again, just more facts and figures for you to kind of see where we're at and where we're going. When you compare the United States to the rest of the globe, when you map them out, it seems like most of Europe has started to peak when you look at the last 5 days. And so it does appear like we're not seeing an explosion of new cases. This graph is only looking at new cases. And so as New York peaks, which they have, they're in the middle of their peak right now, and other states peak, we're going to flatline like these other countries have. Now, a point I'd like to get across is that just because you've peaked doesn't mean it's over. As my guest Chen has pointed out several times, this exponential growth happens very, very, very fast. And then once you peak, you'll see several days with the same number of deaths, kind of like what New York is exhibiting right now. But then the curve back down is going to be slow. It's going to be a slow general curve. I'd say it's going to take us about twice as long to get back down as it took us to get up. And so we're still looking at several months of recovering from this. And if you open the doors too quickly, you're just going to see another explosion of cases. So that's what we're trying to avoid. Just a little bit more information locally. When we look at Allen County information, here's just a graph showing you the number of COVID cases from 318 to 47. So you can see that we did see that kind of exponential nice curved growth of cases here in Allen County. We are starting to see a slight uptick in the number of deaths. And then here's just another visual representation of age distribution, percentage of cases, but specifically looking at Allen County. And so, again, trying to be local, trying to get granular for you so you can see who is being affected and why. Also, here's the distribution in Allen County, again, of age, male versus female. Just a little bit different way of graphing the same data. Another question that we get asked about frequently are, how are the hospitals doing? And we look at the capacity of PRMC, so that's Parkview Regional Medical Center. As of Tuesday, April 7th, we're setting somewhere around 57% of overall capacity. And so 18 out of the 42 ICU beds are open, and 24 out of 72 medical inpatient beds are open. So numbers wise, we're doing pretty good. Again, the hospitals here, at least in Allen County, have not been overran. And this is just a small look at Parkview. There are several hospitals, even just here in Allen County, but that's a look at PRMC. So far, so good. I'd just like to send a shout out to all of the medical professionals. That's everyone from the paramedics to the MDs, the DOs, the PAs, the NPs, the nurses, the surge techs, the rad techs, everybody that is working in the hospital, both on the front lines and behind the scenes to keep everything going. Thank you so much. It's really making a difference in our outcomes here, and you can see it in the data. Specifically looking at who has been hospitalized, again, in Allen County, we're at 64.5% of patients that are coming in are being hospitalized. Of that, only 15% have been intubated. 16.4% are presenting with acute respiratory distress, and 5.3% are deaths. And so here's just a breakdown of what we're seeing in Allen County. Some other community updates. Again, trying to stay local here, is a stay-at-home order or shelter in place has been ordered until April 20th in Indiana. There have been orders for non-essential businesses to close their storefronts. These actions are actually being enforced, and so non-essential businesses, if they are found to be open, are being reported, and the state has issued several warnings. And so the process, if a non-essential business is open, the state will investigate it. The first thing that they're going to do is stop by the business and give them a warning. If that non-essential business were to stay open again, they will then receive a cease and desist letter. And then after that is when they're facing litigation. And so if you're wondering why that non-essential business is still open and you're scratching your head a little bit, they may be somewhere in that process. In Allen County, in Fort Wayne, we don't really have a quick turnaround for tests. If somebody's given a coronavirus test, I've personally spoken with providers that said it's taking in some cases a week or more to get results back. As you're driving around town, if you're picking up groceries or anything, what's qualified as an essential business are things like food, medical, transportation, office supplies. Those are generally what's falling under the essential business categories. There's an entire list on the Indiana State Department of Health site that you can go check out for the list of essential businesses. Other community updates to be familiar with is that there's currently a push for Hoosiers with a BMI greater than 30 and or diabetic to be tested. There has been a huge push to donate PPE, that stands for personal protective equipment. And we're seeing that happen a lot. For example, Home Depot has stopped selling N95 masks, and they now are donating those masks to health providers. There are several other businesses and companies that have done that. I've heard of Harbor Freight donating their N95 masks. I've heard of instances where other companies are doing the same as well. With Easter, obviously, it being Good Friday and Easter Sunday coming up here on Sunday, the governor has not declared churches essential. So some states, such as Texas and Florida, have declared churches as essential. In Indiana, that has not been the case. And so your churches, unfortunately, over this Holy Weekend will not be able to meet. But many churches are doing streaming services. And so please look toward your community resources to find if your church is going to be online. More when we look at the community. The CDC this week has issued suggestions. They've looked at the data from Asia, and they've modified their suggestion of asking people to wear homemade masks to prevent the spread of infection. Now, something I would like to be very clear on is that these homemade masks do not prevent you from breathing in virus particles. The only masks that do that well are N95 masks, but N95 masks also need to be fitted to your face, so you actually have to go through a fit test. And then for men, you cannot have any facial hair. They will not work if you have facial hair. And so leave the N95 masks to the medical professionals. Those N95 masks are preventing the medical professional from being infected. And so the knee-jerk reaction then from most people is, why even wear a bandana or a scarf or a homemade mask at all? And the answer to that is that these homemade masks potentially could prevent you from infecting other people. So again, we've seen studies where airborne infectious particles, if you were to be sitting in a room and you had a coronavirus infection and you were to sneeze or you were to cough, those infectious particles can travel through the air. The CDC's recommended distancing is 6 feet, but that's assuming still air, where air is not moving or circulating around. As soon as the air starts moving, those distances become very, very much higher. And so there is a really nice article that came out today. I believe it was out of the Netherlands. I posted it on my Facebook page that showed if you were outside running or biking, that you should not be running or biking near people. That 6 feet guideline does not work outside where it's windy. These virus particles can travel 20, 30, 40 plus feet if there's wind. And it has been shown that this virus can survive in droplets, airborne droplets in the air, and be infectious. Those viral particles can be infectious for over 3 hours, 3 to 6 hours in the air, and then can survive on a variety of surfaces, everything from steel to cardboard, anywhere from hours to days. That data has been published now for about a month. And so please be careful. Don't get the false sense of security that I can put a bandana on and then I don't have to listen to social distancing. That's not the purpose of it. The purpose of it is if an individual is infected, to try to prevent as much as possible their cough or sneezes or water droplets coming out of their mouth from spreading onto other surfaces or spreading into the air. So that's really what we're trying to prevent here. But I just want to be very clear on that because I don't feel that description has been made clear enough yet. So one last time, bandanas, homemade masks do not protect you from getting infected. They prevent you from spreading virus particles and contaminating others and other surfaces. The last thing that we wanted to mention in the community before we went and talked about our main topic from the day, which is vaccines, we wanted to put this Facebook page out there for you. It's called 2GoFW, so 2GOFW. It is a Facebook group, and it promotes local restaurants and a lot of various carry-out specials. I know in my family we try to use this website. It was sent to me from another professor, Dr. Lou Weber at the University of St. Francis, and she sent it to me, and I joined it. And wow, amazing takeout specials, various ways of supporting your local restaurants and try to help these local businesses stay in business when they can't have dine-in service. And so if you haven't had the opportunity, please go check out 2GOFW, 2Go Fort Wayne. And I don't think you'll be disappointed, and we can really help support our fellow Fort Wayne businesses. Now moving on to some new SARS-CoV-2 research that's been going on. And one of the things that we really wanted to focus on is what's happening with the PPE, and we're going to have a whole episode dedicated to this coming up. But just a little teaser, we're running into instances where hospitals, particularly in New York, are running out of masks. We're seeing it in other parts of the country. Some hospitals, including some of the regional and local hospitals, are providers are being asked to reuse masks. Where they would be given an N95 mask and then asked to use them again. And so is this mask reuse is this mask sterilization or is this mask cleaning process a good idea? And so some new methods have been developed, and these methods have been developed by several companies. So some companies, such as Ohio, there's a company called Bechill that just got FDA approval on their systems. Some people are using UV technology. Other people are using gases or foggers to sterilize the masks. Dr. Richard Peltier and Brian Hollenbeck at the University of Massachusetts Amherst conducted a study late in March to test to see if masks like N95 masks are safe to reuse after a sterilization or a cleaning treatment. And so we really didn't even know before this coronavirus outbreak, if this was possible to do this mask reusal safely. And then, frankly, we're still trying to figure it out on the fly. But in this study that was performed, the tests were conducted using a mannequin head with a fitted N95 mask. And so you can see that mannequin head right here that was fitted with an N95 mask that was fitted properly. So again, you have to be fit tested for these masks. And then the chamber that this mannequin head was placed in was filled with pollutants, so a variety of different pollutants. Then after the masks were exposed to these pollutants, they were sterilized by exposing the masks to a fogger. So it was a hydrogen peroxide fog that was released into the chamber. And ultimately, and you can see an example of what one of those foggers looks like up here on the top. And ultimately, what they did is used a laser to analyze the size of the particles after that fogger, and then they compared the particles that passed through an unused mask and then through one of these sterilized masks. And fortunately, they were able to find no data that showed that the reused mask was allowing particulate through. And so the sterilized mask that was cleaned using a fogger appeared to have no loss of function. Now, other hospitals are using different techniques. Some hospitals are using germicidal bulbs. These are special ultraviolet frequency light bulbs that can essentially sterilize the masks. But again, these are some preliminary studies that are coming out to really try to get at the idea of, can we reuse this PPE? And again, we'll have an entire episode to talk about this in much more detail later. But just kind of your teaser of coming podcasts. Here's just a list. We get several questions on confusion when it comes to symptoms to the coronavirus infection and the SARS-CoV-2 virus itself. And so when we talk about COVID-19, so again, COVID-19 is the name for the disease caused by infection with SARS-CoV-2. What are the symptoms, the signs and symptoms of that disease of COVID-19? So they're listed here. Many of them you know: cough, fatigue, headache, shortness of breath. But some interesting new ones are kind of popping up on the list. So loss of smell or taste. So this has been reported for the last, I'd say, 2.5 weeks. We've been seeing reports come out of Europe, and it seems to be validated as more and more scientific studies are being released on this, that in roughly somewhere around 30% of the cases, if people lose their sense of smell or their sense of taste, that is their first sign that they have a coronavirus infection. So if you're at home and the very first thing you do is, oh my God, I can't taste anything anymore. I can't smell anything anymore. And then you start exhibiting other signs and symptoms as listed on this slide, that could be something that you want to tell your provider about. Also, hoarseness of voice, chest pain, tightness, these are all things that you've seen in the news. But a couple more that you haven't seen in the news is abdominal pain and diarrhea. These are two new symptoms that have popped up. So as we've talked about in previous episodes, there are actually several strains of coronavirus that are circling the globe. And in most of the Middle East and Europe, they have not patients have not presented with the symptoms of abdominal pain and diarrhea. This is kind of a new one that we're seeing. We saw it predominantly in Philadelphia, but now we're seeing it in other parts of the country as well. And so again, normally this infection is a respiratory infection and has not been associated with GI complications, but we are seeing this in the United States. And so some cases, again, not all or not even the majority, but some cases patients are presenting with GI or gastrointestinal issues. So just take a look at this list. This is just an updated list of signs and symptoms that we're seeing here in the United States. Also, something to be aware about, when people come down with COVID-19, the patients are put on what's called supportive care. It's basically bed rest, lots of fluids, and get some sleep. However, especially in the elderly population, this puts your patients at very high risk for blood clots, which becomes an issue. So what are some medications that we're seeing that are being used? And again, this is not medical advice. I am not an MD. Nobody in the class is a licensed provider. We're just trying to get information out there about medications that you would look at or see prescribed for elderly population patients. So aspirin and Tylenol up here on the top of the list are given. However, aspirin additionally has a slight anticoagulant property to it, and so you might see that one getting used. There was some news that came out a couple of weeks ago now, where people said you should not take ibuprofen if you have a coronavirus infection because it makes it work. I'd just like to give you a little bit of history behind that. So where that came from is that it's been shown in cell lines. So these are in labs, in tissues, so not in animal studies, but in cell lines. If cells are treated with ibuprofen, there is an upregulation of the ACE2 receptor. The ACE2 receptor is a receptor that's found on the epithelial cells of the lining of your airways, and it happens to be the receptor that this virus binds to. So the theory was if you take ibuprofen and you increase the amount of ACE2 receptor, that you would be more likely to contract coronavirus. And that's what started that media storm that kind of burned around the world. Nobody should take ibuprofen. I'd like to clarify that that has not been proven in human studies. That was done in tissues in a laboratory, and there has not been a clear connection made between ibuprofen use and impact on human clinical outcomes. And so you have to be very careful sometimes when you see these awe-inspiring headlines. People become frightened or concerned when maybe you should know the science behind what's going on. And so I just wanted to be very clear that ibuprofen, you don't have to be adverse to that at this time. There's not in-human clinical trials that represent that risk. Plavix is not really a blood thinner, but it can make your platelets, quote unquote, more slippery so they can glide past each other, potentially lower the risk of clots. Xarelto, you've heard on the news. It's a blood thinner. You have Lipitor, which many of these you see in commercials, and you have the brand names here, as well as the generic or even clinical names of these medications. And so you've probably heard of Plavix, Xarelto, Lipitor. Lipitor is very popular, medication used to lower cholesterol. And then you have Prilosec, which again is also all over the news. That you're going to, if somebody is on Prilosec, you're going to have intestinal issues. And so maybe that's why we're seeing some of that intestinal issues here in the United States, because a lot of Americans are experiencing diarrhea and abdominal pain. And so if you see a loved one that has been diagnosed with coronavirus infection and you see that they're on Prilosec, it's probably to try to avoid some of those GI issues. Next, we want to talk about testing. This is one of the areas of great frustration, is that we just have not been testing enough people here in the United States. Testing for SARS-CoV-2 used to take days, sometimes weeks, and then in other cases, people just didn't get results back at all. So new systems that are coming out to try to address that system, there are several companies that have come out with systems. So Roche in Indianapolis came out with some rapid test systems. Abbott has been in the news frequently for coming out with their test. Abbott came out because their test is FDA approved, and the advantage to this Abbott system is they can get results in 5 to 13 minutes. And so instead of waiting weeks or just not getting results back, you can get your results back in literally 5 to 13 minutes. So this is promising. This is very, very promising. Ultimately, what this test is doing is it's amplifying a specific part of the RNA genome of this, and basically will make the RNA or the genetic information of the virus glow if there's a positive test results. This test is really easy. They can just do a nasal test, so basically putting the short Q-tip into the nose. There have been some new studies that have come out that have said if you do the nasal pharynx test, which is where you're putting the really long Q-tip to the back of the nasal cavity, that one tends to be a little bit more ouchy and invasive. There have been tests just released this week that compare that test to the back of the nasal cavity versus an anterior or a front nasal swab, and it's shown that the front nasal swab is over 90% accurate compared to the back of the nasal cavity. And so it looks like we might not necessarily have to use the really, really, really long Q-tip to get to the back of your nasal cavity. So that's a huge advantage. You should not be doing at-home tests. There are no at-home approved tests at this time. So if somebody's trying to sell you some at-home remedy or at-home tests, it is a scam. Please watch out for scams. Unfortunately, in times of emergency, we see an increase of that as well. It does not take a whole lot of sample for this Abbott test to work. So for example, a concentration of only 125 genomes per mil. So that's in virus terms, in virus speak, it's a very small amount, can test positive in 19 out of 20 tests. So basically what that's saying is if you can have just a very, very small amount of virus particles in something the size of about a raindrop, this test can give you a positive test. So a very neat improvement that we're seeing. We're still waiting for the hospitals to get their kits in. So we run into an issue where we have these amazing new systems that are coming out. Now we just have to manufacture them and distribute them to the hospitals. And so some of the local hospitals here in Allen County have already ordered several dozen of these, and we're waiting for them to show up. Next, what we would like to do is just kind of give you a little bit of information on policies. We've been getting questions about national policies, county policies, global policies, and regional policies. So what we're trying to do here through all of these is limit transmission, limit secondary infection, and limit international spread. So those are the WHO, or the World Health Organization, really is trying to limit how this virus is being transmitted, isolate those that are sick, and then communicate. That's their goal. After they've accomplished those three goals, they're trying to counter false information, really trying to minimize impacts otherwise. How are they doing this? So the World Health Organization is establishing international coordinations, having all of these different countries talk to each other, talking about what works, what doesn't work, actually sending doctors from country to country as the outbreak subsides in one country. They will send clinicians to other countries, trying to improve clinical outcomes as this continues to spread throughout the world. For locally, if you're testing positive locally, what we're trying to ask people to do is stay at home. Do not it's kind of the quarantine in place at that point. If you are positive, you should not have contact with others in your home unless absolutely necessary. You need to quarantine as much as possible. You should only be leaving your home to get medical care if you've tested positively. You have to separate yourselves from others in a household. If you test positive and you just go home and you just don't go anywhere, but you hang out with everyone in your house, you inevitably will infect or expose at minimum everyone in your house. And so please be careful of that. If you test positive or you have a family member that tested positive, they need to be in their own room, kind of closed off at all times. Additional precautions is that you should be waiting at least 72 hours, so 3 days after your fever goes down, to return to work. Definitely, if you are a healthcare provider, you need to be using an N95 respirator. You need to be doing eye protection, gowns, and gloves. These PPE guidelines change quite frequently. And so some precautions to take, whether you have tested positive at home or if you are working in the hospital systems. Parkview specific guidelines. Hospitals and emergency departments are implementing or have implemented a no visitor policy. All locations have limited access to entrances, reduced hours. Certain areas are closed. Additional screenings are required. There are certain checkpoints where they'll take your temperatures. First care walk-in clinics are only allowing parents or guardians of a minor or a patient caregiver. So you can't go as a family, or you should not go as a family to get walk-in care. It should only be the individuals getting treated and their guardian or caregiver with them. Visitors are limited to 1 adult per patient at all of the clinic locations. And so please only take the people that are absolutely necessary to these appointments. And additional visitors will be asked not to wait in a waiting room, but to actually wait in their car outside. So just some things to expect if you're taking your family members to the hospital or to a walk-in clinic. Currently at Parkview, they have suspended valet parking to try to reduce exposures. And a lot of the events that have been scheduled have been canceled, and that date of cancellation just seems to be pushing further and further out. To wrap up our talk today, what we wanted to do is start answering questions. And so we've asked you, the listeners, to submit questions. And let's just dive right in. And so the first question that we're going to try to answer today was Nick Kiner asked, are there any other theories of the origins of SARS-CoV-2 or COVID-19? Like there's been rumors of the virus was released by a lab and a lab experiment in Wuhan, and that's how this virus outbreak happened. When you first hear that, it sounds kind of like a conspiracy theory. There are some interesting tidbits to that, and so we wanted to kind of break that question down. So when this outbreak first occurred, the first cases started to pop up in China in mid to late November, early December of last year. The first theory was immediately that this virus must have jumped over from a bat, because a lot of times when we see viruses jump from animals to humans, and especially if they're novel infections, a lot of times bats are the carriers. And that's because there's so many different kinds of bats in the world. So, for example, I tell this to my virology classes. There's one species of human, right? Homo sapiens. There's actually over 1,800 species of bats. And so there's a lot of variety in bats that can cause new viruses to be formed. So the original theory was bats must have given us this virus. And that's because the genome of the COVID coronavirus that we're seeing right now is about 96.2% similar to a bat. And so that looked like that must be the transmission that happened. There is no direct proof, though, that occurred. There's no direct proof that this originated from a seafood market. There was some original pictures that had come out in December of somebody eating bat soup and saying that this is where the outbreak started. It was later discovered that that picture was actually taken, I believe it was in Nebraska in the United States in 2016. You can fact check me on that. But it was actually a picture from a United States when that image was taken. And so the idea that it came directly from a bat was shut down. There's also some claims that maybe it jumped in a different way. So, for example, in China, they have these things called wet markets. Wet markets are where you'll have a mixture of live animals and dead animals that are all stacked together. And so you can go to these wet markets and you'll see animals, different kinds of animals, chickens, porcupines, exotic animals, all stacked together vertically. And in these stacks of animals, you can go and pick out an animal you want to take home for dinner that night. They can slaughter it right there in the market and give it to you. And unfortunately, this kind of creates a breeding ground for viruses. And so the current theory is that the SARS-CoV-2 virus may have started actually in a bat, but then was transmitted to a turtle or a pangolin. Pangolin's a very interesting animal. Google that term. I wasn't very familiar with this animal at all until this current outbreak. They look kind of like a combination of, I'll say a porcupine mixed with a hedgehog, mixed with some other armadillo maybe. Very interesting little animal maybe. And then that virus was then transmitted to humans. There has been some rumor that the virus was transmitted from a lab. The equivalent of the CDC or Fort Detrick, which is our Army biodefense lab in the United States, the equivalent of that in China actually is in Wuhan. And so they do have a BSL-4 facility in Wuhan, China. And so that started this kind of theory that maybe this was an accidental lab release. And again, when you first hear that question, it sounds kind of conspiracy theorist, but this lab in Wuhan actually has gotten in trouble in the past, where scientists have sold animals that they've done lab testing in those markets, in those wet markets that we were talking about. And so that has happened in the past. However, when we look at the genome of the current outbreak, there's really not evidence that this is a lab created strain at this time. There are certain ways that when you work in a laboratory setting that you can tell if a virus is intentionally lab created or not. There was an article, for example, that came out that stated that the virus had an HIV sequence in it, proving that it must have been created in a lab. And that created kind of a media firestorm for a couple of days. But then a virologist, Dr. Feng Gao, rebuked that statement, proving that when you look at the sequence, that was just a false statement. So that article was actually retracted. That lab has retracted the article. So there is no direct scientific evidence right now, whether you look at the genetics of the virus or the kinetics of the virus, that this was a lab created virus that was intentionally released. And again, that's going off of current data that we can see right now. What we do know is it probably did come from that wet market environment, and China is in the beginning stages of maybe looking at regulating those markets a little bit more. I hope that answers your question, Nick. The next question comes from Candace, and it says, what was the testing response in Italy and Taiwan? To be honest with you, Italy was frankly underprepared when they had their outbreak kind of start. They started having an outbreak in northern Italy very fast, and it hit them hard and fast. And when the outbreak began, they took a pretty passive approach to coronavirus, that it was just like the flu and there was really nothing to worry about. Then things started to get out of hand. And by February 21st, Italy had created an emergency task force to respond to the outbreak. by February 26th. They came up with testing criteria where they said they will only test people that show signs or symptoms. And then it took them all the way until March 8th to quarantine and self-isolate. They waited too long. They didn't flatten the curve. It took them way too long to respond. And that's why you saw the level of outbreak that you saw in Italy. They waited too long and they got overwhelmed too fast. Now you compare this to Taiwan, which is basically a complete opposite story. Taiwan has completely flattened the curve, and that's because they lived through SARS. They had to go through the SARS outbreak, which again is the first version of this coronavirus. And their SARS outbreak happened in 2003. And so they know exactly what they're doing. They established immediately something called their NHCC, which is their National Health Command Center, in 2004 after SARS happened, to specifically gear for an outbreak, whether that was a local or regional or international pandemic. They had mechanisms in place. And when I say they had mechanisms in place, in Taiwan, they literally have cameras installed in the airports that scan anyone walking through the airport if they have a fever live. And so they've had this again for, since 2003, 2004. Taiwan also has a toll-free hotline that you can call in if you have suspicious symptoms. And then as soon as China released the genetic information, the genome for SARS-CoV-2 on January 10th, our current outbreak, that's when the genetic information was released publicly, they immediately started creating their testing. So they had their testing ready to go right up front. They've done over 2,200 tests every day. It's increased to over 3,000 tests a day after the first death in Taiwan, which is February 16th. And so this is kind of the tale of two countries responding in completely opposite ways to a pandemic. And Taiwan did it right. They have a nice flat curve. Italy waited too long, and you saw what happened there. And so great question, Candace, and I hope that we learn lessons and look towards countries like Taiwan for future ways of preventing these pandemics from occurring. Then our last question that we're going to consider today is from Lauren. Lauren asks, can you help me understand asymptomatic carriers? Sure, I would be happy to. So asymptomatic carriers, these are people that become infected with the virus but don't show symptoms. All right, you do not show, you don't get ill, you don't have this illness that's going on. So the percentage of the population that is truly asymptomatic ranges dramatically. When this virus first came out, we thought that asymptomatic carriers could account for upwards of 80% of viral infections. Those numbers over the last month have changed dramatically. Our current best guess or best models is that somewhere between 2 to 18% of people are asymptomatic carriers. The majority of people who were asymptomatic at the time can go on to develop some symptoms within 12 days, but others just will not. The problem with this is if you are an asymptomatic carrier, you get infected with the virus. Some preliminary studies have shown that you can transmit virus within an hour of being infected because the virus starts replicating in the back of the throat very rapidly. And so if you don't show any symptoms for, let's say, maybe up to 12 days, that can cause problems because you're spreading the virus to others unknowingly. CT scans of the chest show that approximately 70% of patients deemed asymptomatic. So 70% of patients that are asymptomatic, not showing symptoms, still presented signs of the infection in their lung tissue. And so even if you're outwardly asymptomatic, that doesn't mean that the virus is not replicating in your lungs. And so it's very, very interesting from that front, is that you can truly be a silent carrier of this infection. So there are current studies going on looking into the hypothesis that groups that are asymptomatic may not be able to distinguish between the symptoms of infection and underlying conditions. So if somebody, for example, has really bad allergies, they might not ever think that they have coronavirus, but they do. Another group is smokers. If you're a chronic smoker and you start coughing a little bit more, sometimes people don't think too much about that. So overall, there's not a massive amount of evidence that can tell us a hard number on how many cases of SARS-CoV-2 are truly asymptomatic or how or why these cases occur. But it's important to realize that just because you don't feel sick, that doesn't mean that you should ignore social distancing, because you could be very well actively transmitting this virus. And then lastly, today, a preview of upcoming podcasts. April 17th, we're talking about PPE, what works, what doesn't. There's been a lot of information out and about the public. Next Friday, we are still trying to determine a topic. And then the Friday after that, we're going to be talking about the experimental medications that potentially could be used outside of vaccination to treat this pandemic. So, if you have questions, as always, for the next week, you will be able to submit your questions online. Just go to slydo.com. So very, very simple process. All you have to do is go to that website and type in the event code below, which is 69150. Again, that's 69150. And you can type in your question and we'll get it and be able to review your questions right away. Real simple process there. And so just today in review, we looked at updated numbers, got a lot of very helpful local information, talked a little bit about research, updated policies, answered some of your questions, and talked about what episodes you're going to see here in the future. So I really look forward to seeing you this Friday. Thank you so much for your time. Have a wonderful day. Stay safe, stay home, and we'll talk to you soon. Thanks for tuning in to Just the Facts Podcast.